It's a pleasure to introduce our distinguished speaker, Dr. Najla Al Ali. Najla graduated from University of Jordan Dental School with a bachelor degree in dental sciences, class of 1995. She then moved to the United States with her husband and started her family. She joined University of Cincinnati, Ohio in 2006 and completed a Master of Science in Clinical Research and Epidemiology. She joined Moffitt Cancer Center in 2010 as a clinical data specialist in the Hematologic Malignancies department and has been promoted to Senior Hematology Clinical Data Analyst in 2012. During her work journey, she built the largest Myelodysplastic Syndromes database nationally and internationally, as well as other different myeloid diseases databases such as AML, Myelofibrosis, and Chronic Myelomonocytic Leukemia, among others. The scope of her work includes building coded data collection sheets, reviewing patient charts to extract all patients' demographics and disease baseline characteristics, applying various risk models to calculate disease risk scores, assessing each treatment, capturing response, relapse, and adverse effects. She also conducts all statistical analysis using SPSS for abstracts and manuscripts submitted by faculty from database-specific projects. She received multiple grants to support her work, including NIH grant funding in nationally recognized projects such as ASFOR, NIH MDS, Natural History Study, and NIH AML grant study. Her work has helped publish, co-author over 91 manuscripts. Welcome, Najla, and please share your experience with us today. Thank you.
Assalamu alaikum. I just like to show my appreciation for being included in this conference. My name is Najla Al Ali. I am the Senior Clinical Hematology Data Analyst at Moffitt Cancer Center in Tampa, Florida, and my lecture today is titled as Approaches to Data Collection and Analysis. So first off, we start with clinical research. We have to go over the general types of clinical research, which is interventional trials and observational studies. Observational studies are a type of analytic studies to examine the etiology and causal association, while interventional trials, the researcher uses some kind of intervention, whether it's a medication or a new procedure, that the patient gets either randomized or non-randomized in that trial. For observational studies, they are subgrouped into cohort studies, which include both prospective and retrospective, case control studies, and cross-sectional studies. Retrospective studies is a type of study that uses existing data that have been recorded for reasons other than the research and allows the investigator to formulate hypotheses about possible association between an outcome and an exposure, and to further investigate the potential relationships. And there are two types of retrospective studies. One is case control study, and the other is a retrospective cohort study. Prospective studies, you identify a cohort of interest at the time of diagnosis, and they follow them over time forward. And an example of that would be a natural history of MDS study or any other disease you're thinking of. The disadvantage is cost, time, and attrition to bias, which is loss of the patient to follow-up. Retrospective studies are also called historical studies. The main difficulty in this type of studies is that it is performed in the present time but using data collected in the past. So the data can be inaccurate, incomplete, or inconsistent, specifically if it is a multi-center study. The main advantage is the availability of data, low cost, and shorter time than prospectives. Case control studies, we identify an outcome status, for example, a disease diagnosis, then match with cases that are free of that outcome or diagnosis from within the same population. And we use something called the propensity score matching in SPSS. Advantages, it is inexpensive, short time, less number of cases are needed for those types of studies, and we can study multiple risk factors at the same time. The disadvantages is that matching can be difficult, and it's difficult to validate the data, and case selection and data susceptibility to bias. Now we come to cross-sectional studies. These studies are also part of the observational studies. We analyze data of variables collected at one given point in time across a sample of population or a predefined subset, most relevant to access disease prevalence. For example, we are looking at the prevalence of prior exposure to chemotherapy in MDS patients. Advantages of this type of study is that it is inexpensive and we can study again multiple variables at the same time. The disadvantage is that we cannot make or determine cause and effect, and it is limited to a time point. Then now we have to come to what is really interesting, which is the data collection. So before we can start any data collection, we have to have a prior knowledge of the disease, the basic science, and the clinical information about that disease so that we can determine the data point elements that we are going to collect. Of course, again, we are now talking about retrospective studies. So we need a platform to collect those data, and I'm going to show you here the three most common types that I use during my work. The first one is Excel. The advantage of that is that you enter the data in a numerical type of entry where it is identified by statistical software. It has easy data entry level, and you can do some basic calculations. While the disadvantages is that we have a limited number of columns and rows. So if you have a large data set, it can be very limiting using Excel. We need a large hard drive for storage space, and we cannot use multiple people to enter the data at the same time. But the most important disadvantage of using Excel as a platform is that it is prone to human transcription errors. The second type of platform that we use is called REDCap, which stands for Research Electronic Data Capture. And it is a type of a secure web application. So basically we do not need any type of storage space. Multiple users can use it at the same time. And it has a low transcription error because of the interactive editing checkpoints. And that causes the data to be consistent all across. The disadvantage is that you need training to format the forms, and also it can be time consuming, especially if you are using or abstracting multiple or large data sets. The third type is called Google Sheets. They are free, easy to use, and they can be customized according to your research interest. They need constant internet connectivity, and the main disadvantage is that they are not secure because they're available on the web. So now we have decided that we're going to use Excel sheets. Again, we need to know what are the data elements that we're going to abstract. We need to know the two types of variables and how we're going to enter them, whether they are continuous or categorical. And then basically in general, all data spreadsheet have the same structure in terms that you have to have patient demographics, disease background information or diagnosis, treatment and responses, outcomes, survival and progression, and then you can add any variable of interest that you think is relevant to your research. I'm going to show you right now. Here I'm showing you an example of the MDS database. This is an Excel platform, and I have to say that MDS is standing for Myelodysplastic Syndromes, which is a type of blood cancers. And you can see that we have entered here all the data in numerical values. And in this case, we have to remember to put a coding for each column. For instance, in this case, the gender, 1 equals male and 2 equals female. In cases of vital status, then 0 equals dead, 1 equals alive, and so on, so that anybody who uses this spreadsheet would know what each and every number means or reflects. Now, it's worthwhile to mention that you have to search the web for important tools that you can use. In cases of MDS, we have many tools that we can use that are free and available on the web. For example, we have the MDS International Prognostic Scoring System Calculator, or the revised IPSS calculator, which is a type of risk models that stratify patients with MDS. And in this part of the screen, I can show you the revised IPSS, where you can plug in the patient's blasts, his CBC numbers, his cytogenetics, and then it will give you his risk model. In this part of the screen, we can, or slide, there's something called the Charlson Comorbidity Index Calculator, which gives you the comorbidity of that patient, and based on that you can make decisions related to treatments or future transplant. So basically just look online for what is relevant to the disease that you're working on. So now we have collected the data, entered them in the platform of our choice. So we need to, again, define rules for data collection and handling missing data. And that's part of the procedure manual of data abstraction. We have to review data entry, capture all variables needed for the analysis, but put in your mind that some points will need to be calculated using statistical software, such as, for example, overall survival. And then we have to do a 10% quality assurance by a second reviewer. And then we have to format the cells according to the variable we are collecting. For instance, whether it's a date or a percentage or a number, because that's how the statistical software will identify it. Now we come to the statistical softwares. We have multiple and many statistical softwares available. Those are the most important, or the most that I use in my work. One of them is SPSS, and the nice thing is that it provides a free trial online, and it's easy to use. It has the basic functions like descriptive analysis and more advanced statistical functions, and it can import and export data from other platforms like Excel and REDCap. It performs a wide variety of basic and advanced statistical and graphical techniques at a little or no cost. But it's more difficult to learn than SPSS. SAS is mainly used if you have an extremely large data elements, and Excel can by itself be used for statistics, but there are some calculation errors Microsoft team is working on. It's time consuming and it needs a very steep learning curve. I'm going to show you now. Now I'm going to show you a SPSS spreadsheet, which is exported from the Excel sheet that I showed you earlier. It is worth noting that you can use SPSS as an entry data level spreadsheet, but this is how we do it here. You can start with an initial tutorial online to learn how to use SPSS, but it's also important to have that software installed on your computer so that you can play around with it and learn your way through it. This is important to know that there are some variables that you need to compute, and there are some variables that are already collected during the data abstraction, which goes into your analysis. I'm going to use overall survival as an example of how you can compute a variable using SPSS. In this case, you have to hit transform. From transform, you will get a pop-up window where you can enter what does overall survival mean. In this case, it's date of death or last contact minus the date of diagnosis divided by 30. It gives you survival in months at the end of the spreadsheet right here. And you have to do a quick quality check to see if there is any negative values, because negative values can mean either of two things. The first thing is that you entered the data wrong, or the SPSS did not identify the data when it imported the Excel sheet. So we can use the variable that we have computed or calculated in the previous slide to further our analysis. For example, overall survival can be used to compute or graph the Kaplan-Meier overall survival for that cohort of patients. And in this case, we will hit Analyze. Then from Analyze, we would choose Survival. From Survival, we go to Kaplan-Meier. This will get a pop-up window where you enter the overall survival, the vital status. You ask the statistical software to graph or plot your survival, and you hit Enter. You get an output window, which looks like this. It's worth mentioning that any calculation SPSS does will give you an output window with all the calculations that you did. And in this case, it shows you the median survival for our cohort, which is 65 months. And this is how the survival looks on a graph. From my perspective as a data research analyst, this is the last step in our data collection in observational retrospective studies. In this case, we have to use the statistical analysis that we have performed using the SPSS software or any other statistical software to draw conclusions and make significance and implications of those analyses. We have to keep in mind that in retrospective studies, we need to have a basic idea of the history of the disease, what is reported in previous studies for comparative purposes of our data analysis. And then we have to know that collaboration is important to validate data analysis conclusions among different institutions. Thank you. This is my email. I hope you learned from my presentation.